Mental health after the age of 60 is a deeply important aspect of overall well-being that, too, often goes unnoticed or understated. As people move into the later stages of life, they experience a complex mix of physical, emotional, and social changes that can shape how they think, feel, and interact with the world around them. The transition into retirement, while it can bring more free time and personal reflection, may also lead to a loss of identity or purpose, especially for those who have defined much of their life by their careers. The passing of friends, partners, or family members introduces grief and loneliness that can linger, sometimes quietly eroding emotional resilience over time. With aging, the body undergoes biological changes that can affect the brain's chemistry, increasing the risk of mood fluctuations, depression, and anxiety. Reduced mobility or chronic illness may limit independence, adding frustration and a sense of helplessness that can influence self-esteem. The combination of these factors can leave many older adults feeling isolated or disconnected, even in the presence of family. Moreover, social circles often shrink with age, and opportunities for deep human connection become fewer, making loneliness one of the most silent yet devastating challenges of aging. Despite these realities, this stage of life also holds immense potential for growth, acceptance, and rediscovery. Many older adults find renewed purpose in mentoring others, volunteering, or engaging in creative or spiritual pursuits that give meaning to their days. The wisdom gained through decades of lived experience can become a powerful anchor during times of uncertainty or change. Maintaining mental health in this phase requires awareness, compassion, and a proactive approach. Regular physical activity, proper sleep, balanced nutrition, and consistent medical care can make a profound difference in cognitive and emotional health. Equally vital is social engagement. Staying connected with family, friends, and community members provides emotional nourishment and a sense of belonging. Support groups, therapy, and mindfulness practices can help process grief, manage anxiety, and maintain mental clarity. Professional guidance from psychologists, psychiatrists, or geriatric counselors can ensure that emotional concerns are treated with the same seriousness as physical ailments. Recognizing symptoms of mental distress early, such as withdrawal, confusion, or persistent sadness, allows for timely intervention and better outcomes. Ultimately, mental health in later life is not just about avoiding illness, but about embracing well-being in its fullest sense. It means nurturing hope, staying curious, and valuing oneself even as the world changes. Aging does not diminish the human capacity for joy, love, and learning. It simply invites these experiences to take on new, richer forms. When society encourages older adults to stay mentally active, emotionally expressive, and socially connected, it not only improves individual lives but strengthens communities as a whole. Every stage of life deserves emotional care, but after 60, that care becomes both an act of self-preservation and a profound expression of wisdom. The aging process has a profound yet natural impact on the human brain, influencing how we think, feel, and respond to the world. As the years progress, it's common to experience a gradual slowing of cognitive speed, where tasks that once seemed effortless require more concentration and time. Memory recall may lose some of its sharpness, and multitasking becomes more demanding. These shifts are part of the normal spectrum of aging. However, when changes in memory, attention, or decision-making begin to significantly disrupt daily life, they may signal something beyond normal aging and perhaps the onset of a mental health condition or a neurocognitive disorder that warrants professional attention. Depression stands among the most common yet most overlooked mental health concerns in adults, age 60 and above. Unlike in younger individuals, depression in older adults doesn't always manifest through visible sadness or tearfulness. Instead, it often presents subtly as fatigue, a lack of motivation, poor concentration, difficulty sleeping, irritability, or a loss of enjoyment in activities that once brought pleasure. This quiet transformation can be deceptive, as many attribute these symptoms to just getting old or side effects of other medical conditions. Such misconceptions can delay proper diagnosis and treatment, leaving many seniors to silently endure what could otherwise be managed with therapy, medication, or social support. For older adults, depression can intertwine with physical illness in ways that make identification more complex. Conditions like diabetes, heart disease, or arthritis not only strain the body but can also diminish a person's emotional reserves, Chronic pain and limited mobility may reinforce feelings of hopelessness, while medication side effects can further cloud emotional clarity. Because of this overlap, many healthcare providers must rely on nuanced observation and careful dialogue, listening for changes in behavior, speech patterns, or mood that reveal deeper distress. Anxiety, too, plays a significant role in the emotional landscape of older adulthood. Though often underrecognized, it can take many forms: persistent worry about personal health, fear of losing independence, concern about finances, or preoccupation with safety and mortality. These fears, when unchecked, can grow into chronic anxiety disorders that drain mental energy and reduce quality of life. Unlike the sharp, intense anxiety attacks often seen in youth, anxiety in seniors may appear as restlessness, muscle tension, digestive issues, rapid heartbeat, or disrupted sleep. What complicates matters further is that these physical symptoms can be mistaken for other medical problems, such as heart disease or gastrointestinal conditions, masking the true emotional cause. The elderly might find it difficult to articulate their anxiety, perhaps because they were raised in a generation where mental health was not openly discussed, or because they fear being seen as weak. Yet beneath this silence, anxiety can profoundly impact their well-being, leading to isolation, decreased appetite, or even an increased risk of physical illness. In many cases, anxiety and depression coexist, creating a heavy emotional burden that affects both mind and body. When these two conditions overlap, the individual may experience chronic fatigue, poor concentration, and heightened irritability, making even simple decisions feel overwhelming. It's not uncommon for this combination to go unnoticed, as the symptoms often blend into the broader experience of aging or physical decline. This dual presence demands an integrated approach to care, one that acknowledges both the psychological and physiological components of distress. Older adults may also develop specific phobias or fears related to their environment and circumstances. The fear of falling, for instance, can become paralyzing, discouraging mobility, and contributing to social withdrawal. Others may fear hospitalization, medical procedures, or the concept of mortality itself. These fears, though deeply human, can restrict independence and create a self-reinforcing cycle of anxiety and avoidance. Recognizing these fears compassionately and addressing them through therapy, exposure techniques, or relaxation training can significantly improve emotional resilience and daily functioning. Clinicians working with older adults face the delicate task of distinguishing anxiety and depression from the natural effects of aging and chronic disease. This requires sensitivity, patience, and collaboration. Comprehensive assessment involves not just medical evaluation, but understanding the person's life, history, losses, and support systems. Emotional pain in late life is rarely one-dimensional. It's shaped by years of experience, shifting roles, and evolving identities. Integrated treatment approaches tend to offer the best outcomes. These may include psychotherapy, especially cognitive behavioral therapy tailored for seniors, alongside medication when necessary. Encouraging social engagement, regular physical activity, and hobbies that stimulate the mind can also reduce symptoms of both depression and anxiety. Moreover, cultivating open communication within families, where feelings are shared without judgment, creates a supportive environment that fosters healing. Ultimately, mental health challenges in older adulthood are not signs of weakness or decline, but reflections of a lifetime adapting to change. The mind remains capable of growth and recovery at any age when met with empathy, clinical care, and community understanding. Recognizing the difference between normal, aging, and treatable conditions is the first step toward preserving not only mental clarity but also the dignity and joy that make later life meaningful. Beyond mood and anxiety disorders, cognitive impairments such as mild cognitive impairment, MCI, dementia, and Alzheimer's disease represent significant mental health challenges for the aging population. While occasional forgetfulness can be a normal part of aging, persistent confusion, disorientation, or significant memory loss that interferes with independent functioning signals the need for medical assessment. Early detection of cognitive disorders allows for interventions that may slow progression, optimize daily functioning, and support family caregivers. Multidisciplinary care involving neurologists, Psychiatrists and occupational therapists can help maintain the best possible quality of life for patients with cognitive decline, social and emotional. Isolation constitute another major risk factor for poor mental health outcomes in older adulthood. After retirement, many individuals lose the structure, social contact, and sense of purpose that employment provided. The deaths of close friends or a spouse can further intensify feelings of loneliness and detachment. Research has consistently shown that social isolation is associated with higher rates of depression, anxiety, cognitive decline, and even cardiovascular disease. Maintaining social connectivity, whether through community programs, volunteer work, or digital communication, can significantly enhance mental and emotional resilience. Simple acts of participation, joining a book club, attending religious services, or spending time with grandchildren, can restore a sense of belonging and mitigate psychological distress. The interplay between physical and mental health is particularly pronounced in individuals over 60. Chronic conditions such as diabetes, cardiovascular disease, arthritis, and sensory impairments can limit independence, create persistent pain, and contribute to emotional exhaustion. Polypharmacy, the simultaneous use of multiple low medications, is common in this age group and may lead to drug interactions that influence mood, cognition, or sleep. Therefore, regular communication among physicians, mental health professionals, and caregivers is essential to coordinate treatment and monitor side effects. Conversely, maintaining physical health through gentle exercise, balanced nutrition, and adequate sleep can substantially improve mental health outcomes. Exercise stimulates the release of endorphins and neurotransmitters that promote positive mood and cognitive clarity. Nutritional interventions that emphasize omega-3 fatty acids, whole grains, fruits, and vegetables support neural function and overall vitality. Treatment for mental health disorders in older adults should always be individualized, taking into account comorbid medical conditions, cognitive capacity, medication tolerance, and social support systems. A combination of psychotherapy, pharmacotherapy, and lifestyle modification tends to yield the best outcomes. Psychotherapy, particularly cognitive behavioral therapy, CBT, has demonstrated strong efficacy in addressing depression, anxiety, and adjustment disorders in the elderly. CBT helps individuals identify maladaptive thought patterns, develop coping mechanisms, and improve emotional regulation. Interpersonal therapy, IPT, can also be effective, especially when grief role transitions or interpersonal conflicts are central issues. Group therapy may provide both emotional support and social engagement, reducing feelings of isolation. Pharmacological treatments, when necessary, must be prescribed carefully. Older adults metabolize drugs differently, and the risk of adverse effects or interactions is greater. Selective serotonin reuptake inhibitors, SSRIs, are typically considered first-line medications for depression and anxiety in this population due to their favorable side effect profile. However, clinicians must remain vigilant about potential issues such as hyponatremia, gastrointestinal bleeding, or fall risk. Regular follow-up, dose adjustments, and monitoring are vital components of safe medication management. In cases of dementia-related behavioral symptoms, antipsychotic or mood-stabilizing medications may be used sparingly and only under close supervision. Lifestyle interventions complement clinical treatments and empower older adults to take an active role in their mental well-being. Engaging in meaningful activities, whether through creative pursuits, volunteering, or lifelong learning, can restore a sense of purpose and autonomy. Mindfulness-based practices, meditation, and relaxation techniques have been shown to reduce stress, lower blood pressure, and enhance cognitive function. Even short daily sessions of deep breathing or guided imagery can yield measurable improvements in mood and concentration. Sleep hygiene is equally important, as insomnia and fragmented sleep are common in older adults and strongly correlated with depression and anxiety. Encouraging consistent sleep routines, limiting caffeine, and creating a calm nighttime environment can promote restorative rest. The role of family members and caregivers in supporting mental health among older adults cannot be overstated. Emotional understanding, patience, and open communication are essential for effective caregiving. Many seniors hesitate to express their emotional struggles out of fear of being a burden or appearing weak. Creating an environment where they feel safe to discuss their feelings can greatly enhance treatment outcomes. Caregivers, in turn, must be mindful of their own mental health. The stress of providing long-term care can lead to burnout, depression, and physical fatigue. Access to caregiver support groups, counseling, and respite services can help sustain the well-being of both the caregiver and the patient. Advancements in technology have opened new avenues for supporting mental health in later life. Teletherapy, online counseling, and mental health applications have made professional help more accessible, particularly for individuals with mobility limitations or those living in rural areas. Digital platforms also facilitate peer support through online communities where older adults can share experiences and encouragement. Additionally, cognitive training programs, memory games, and brain fitness applications can help maintain cognitive function and engagement. Nevertheless, it is important to balance digital interaction with real-world social contact. Excessive screen time or exposure to misinformation can exacerbate anxiety or confusion. Families and clinicians should guide older adults in using technology safely and effectively. The intersection of spirituality and mental health is another area of growing recognition in geriatric care. Many older adults derive comfort, meaning, and hope from religious or spiritual practices. Participation in faith-based communities has been shown to reduce stress, promote social connection, and enhance coping mechanisms during illness or grief. For those who are not religious, finding personal meaning through philosophy, nature, or mindfulness can serve a similar stabilizing role. Encouraging these practices can complement medical treatment and contribute to holistic mental wellness. Public health systems and policymakers also have a role to play in promoting mental health among aging populations. Expanding access to geriatric mental health services, improving caregiver support infrastructure, and integrating mental health screening into primary care visits are critical steps. Training healthcare providers to recognize and address mental health symptoms in older adults can lead to earlier intervention and better outcomes. Community-based programs that promote social engagement, physical activity, and education about mental health can further reduce stigma and empower seniors to seek help when needed. Ultimately, maintaining mental health after 60 requires a multifaceted, compassionate, and proactive approach. It involves addressing not only clinical symptoms but also the broader psychosocial environment that influences well-being. Emotional health is inseparable from physical health. When one is neglected, the other inevitably suffers. Encouraging older adults to remain socially active, mentally stimulated, and physically healthy can significantly enhance both longevity and life satisfaction. With the right support systems in place, medical, familial, and societal, aging can be not just a period of decline, but a meaningful stage of continued growth and fulfillment. Mental health in older adulthood should never be regarded as an afterthought, but rather as an essential foundation of overall well-being. As people age, their physical health often takes the spotlight, while emotional and psychological needs fade quietly into the background. Yet the truth is that emotional resilience, adaptability, and the capacity for growth remain alive and accessible well into later life. The human spirit does not lose its strength with time. It simply expresses it in gentler, more introspective ways. Many older adults find themselves rediscovering purpose, nurturing relationships, engaging in creative expression, or offering mentorship that gives depth to their remaining years. They often carry within them a wisdom born of experience, one that can serve as both a guide and a gift to younger generations. This stage of life offers a unique opportunity for transformation rather than decline. By shifting how society views aging, we can begin to recognize that mental and emotional growth are lifelong processes. Education plays a vital role in this transformation, helping communities understand that mental health care is just as crucial as managing blood pressure or diabetes. Empathy bridges the gap between generations, reminding us that compassion and understanding are powerful tools for healing. Evidence-based interventions, from counseling and cognitive therapies to social engagement and mindfulness, can enrich emotional wellness and foster a sense of belonging that so many older adults yearn for. The goal ultimately is not merely to extend the number of years a person lives, but to ensure that each of those years carries meaning, joy, and emotional balance. A life rich in purpose and human connection is what transforms aging from a fearful process into a fulfilling journey. It is about ensuring that every individual beyond 60 has access to the mental, emotional, and spiritual care that allows them to live with dignity and inner peace. By focusing on holistic health where mind, body, and spirit are treated as one, we can help seniors thrive rather than simply exist. Aging inevitably brings challenges. Physical limitations, loss of loved ones, and changing identities can create moments of vulnerability. But even within these experiences, there lies an opportunity for strength and rediscovery. Mental health after 60 is not defined by the absence of sadness or illness, but by the continued pursuit of balance and self-understanding. It's about finding moments of meaning amid the noise of everyday life, cherishing small victories, and remaining open to the beauty of human connection. The elderly, who are supported by caring families, compassionate professionals, and inclusive communities, often experience a renewed sense of vitality that transcends their physical years. Integrating mental health care into routine medical support can make this vision a reality. Physicians, caregivers, and families must work together to recognize emotional distress early and address it with sensitivity. Community involvement through support groups, senior centers, or faith-based initiatives can restore a sense of belonging and purpose. Psychological support, whether through therapy or peer companionship, helps break the isolation that too often shadows aging. Personal empowerment also plays a key role. When older adults feel they still have choices, goals, and a voice in their own care, their confidence and hope flourish. The collective effort to prioritize mental wellness among older adults speaks volumes about a society's compassion and progress. It represents not only a medical responsibility but a moral one. Supporting the mental health of seniors honors their lifelong contributions and ensures that they continue to experience dignity and joy in the years ahead. The most meaningful gift we can offer those entering the later chapters of life is not pity or fear of decline, but a vision of aging filled with acceptance, connection, and peace. In the end, mental health after 60 is about nurturing the light that remains, helping it shine even brighter, despite the shadows that time may bring. When we create an environment where emotional care is valued, where listening replaces dismissal, and where every person feels seen and supported, we elevate the experience of aging for all. Modern healthcare must continue to evolve, not only through technology and medicine, but through humanity and heart. To prioritize mental wellness for older adults is to affirm that every life, no matter its stage, still holds purpose, meaning, and the boundless capacity to feel alive.